Sometimes patients ask the question, should I get a traditional implant or should I get a mini implant? And what's the difference? So what is the difference? A traditional implant is a larger implant, and it takes a series of drills to place it, and you remove more bone. And it takes a longer healing time, anywhere from 3 to 4 months. Whereas a mini implant, a lot of patients like because it's more affordable. They could come into the office, get it placed, it's less invasive, and you have more success rate when you start talking about peri-implantitis, where you get infection, because you have all these connector pieces. And with a traditional implant, there's 3 pieces. So when you put it all together, you might have this little microscopic little layers that's just really small. But that's why it's so important for your oral hygiene. It'd be great to remove all that. But with the mini implants, patients are looking at that as a more affordable option. It's less invasive, it takes less time for the placing and healing. And when the patients I've talked to got many implants, they said, I just can't believe it. I didn't have any pain or discomfort. They took one Motrin and they was out the door, and they were just really happy. And I was pleased, and so were they.